If you're anything like me, like learning anatomy through sports injuries, this is episode 50. I want to say thank you so much for supporting the series. I can't believe it's already been 50 episodes. Thank you so much for watching. I have so many suggestions to get to. Let's go back to what started it all. Kevin Ware, March 31st, 2013. This could be bad here, so just be aware, all right? Kevin is playing for Louisville here in the March Madness tournament. He goes down and his leg snaps in half. Okay, we have another angle of it here. Obviously, that's not good if you have an extra knee. That's not good if you're Kevin Ware. Okay, so let's slow it down and take a look. So he's going to jump and try to block, and he's landing kind of on the side of his foot, so you would think it's an ankle. What happened was the ankle gave out as well as the leg, and there's that extra knee. So the ankle kind of gave out first, and then the tibia couldn't handle the force, and it broke there. So what I think happened, since he was going kind of horizontally in the frontal plane, and then the compound fracture happened in the front of his leg in the sagittal plane, I think it was more of a torsional force at that tibia. That's what at least I think happened. So what's involved here? Obviously the tibia, it's a compound fracture because the bone was outside of the skin. Obviously I can't show that on here, but we know what happened. So the muscles involved tibialis anterior extensor digitorum longus. Those run across the front of your shin. So those would just be kind of like out of whack and shortened because that tibia is poking out of the skin and it's not giving that tension. All right, so danger here would be the anterior tibial artery could have been severed here, which would lead to excessive bleeding. But we didn't see any blood on the court, so that's good news if you were Kevin. And the deep peroneal nerve, or also known as the deep fibular nerve, they're the same thing. They just make it impossible to remember because there's two different names for the same thing. But that also runs through the front of your leg, which could have been disrupted here in a severe compound fracture like that. But luckily for Kevin, that did not happen. That nerve is responsible for dorsiflexion, which is bringing your toes towards your head, as well as sensation between the first and second toe. All right, so what did they do for Kevin Ware? Well, they did a surgery, obviously. He needed a rod placed in the tibia. And as we've talked about before, bone fractures have better recovery times than like a ligament injury, okay? So a possible complication for a surgery like this would be infection, deep vein thrombosis, or DVT, or compartment syndrome. Luckily, again, nothing happened here, but a DVT could travel from the surgical site up into the lungs and become a pulmonary embolism, which is life-threatening. So just be aware of that. Physical therapy to return to sport. So he actually got back faster than they thought he would. He returned 7 months after the injury, and he was already stationary biking at five weeks. And then you start to increase the weight bearing at about 6 weeks. So before 6 weeks, kind of not weight bearing with some crutches. But he did return 7 months later, and he actually won the Sun Belt Championship and was named the MVP in 2015 after he transferred from Louisville to Georgia State. He then signed overseas and played in Iraq until about 2022. And right now, he's a scout and a recruiter for a basketball recruiting company. So that is Kevin Ware.